Welcome to the Fire Rescue Wellness Podcast Spotlight, where we revisit take-home messages and shine a light on previous FRW podcasts in 10 minutes or less. I'm Lex, AZ's right and left-hand woman, and I churn out these mini episodes for her. Let's go.
Same answer that I have as before. I don't have that answer. I have a hypothesis, and that is if you've had knee pain, back pain in your past, it is more likely to have that sort of pain. Is that for fact? No, it's anecdotal. But it's kind of like when you have the flu or when you have acute COVID and you have joint pain, like it's deep and it's achy and annoying. So everyone's different. Moving target. Don't have a direct answer for that, but my hypothesis is if you have, for instance, arthritis in your knees or your back, you might be more likely to have pain at those joints compared to others.
Interesting.
So, what I tell anytime I'm teaching about COVID, long COVID, this disease process was novel. We use the term unprecedented quite a bit. But I like to remind healthcare professionals or whoever's dealing with and treating with this population is that we don't have to reinvent the wheel. We need to use the knowledge that we have dealing with other diagnoses and bring it here. So the two big things that we were seeing was this breakdown in certain areas. And so one of my breathing exercises is very specific to that. And the other is this inflammatory piece, right? Like this inflammation seems to be the culprit. Brain fog is inflammation, like there has to be. Loss of taste and smell, lots of possible causes for that. Is it destruction at the nerve itself? Is it inflammation of the brain that senses that sort of like loss in taste and smell in the brain perception? Lots of possibilities, but it kept coming back to inflammation. So lymph drainage is not my normal realm. But because I was breaking this down and I kept seeing inflammation, I kept asking, how do we deal with inflammation? So you can deal with inflammation a number of ways. Lymph drainage was particularly kind of stuck out to me because it's the waste system, right? So if we have these stuck points in our waste system, then it's going to cause issues. So lymph drainage is my one piece of this. And I will tell you, when people are in the acute phase, it's the first thing I tell them to do. It's gentle rubbing in specific spots related to the lymph system. And the idea is that you're clearing the pipes. You're clearing the sewage. You're clearing it out so that we can keep replenishing and basically help alleviate some of that inflammation. So there's a whole head and neck routine. There's a full body routine. And people really do, especially if they have high congestion, brain fog, feel very different as soon as they're finished performing it. So that's been one big piece. The other thing that's happening with long COVID is the heart rate response. So I don't know if you know anyone who has had COVID. The return to high level activity is difficult because the resting heart rate is high. So again, there's a number of possible hypotheses as to why, but the vagus nerve is starting to get a little bit more press these days. And essentially, if you're thinking about the nervous system, you have two sides of your nervous system that help with heart rate, blood pressure response. You have sympathetic and parasympathetic. So your sympathetic is your fight or flight. It's going to get your heart rate, blood pressure going up. And your parasympathetic is known as your rest and digest. But it's more than that. It's your base. So your resting heart rate is set by your parasympathetic system. It also is what helps you come back down off of exercise. So when you're recovering during exercise, it's your parasympathetic system kind of driving that. So why is it happening? Not sure. Again, could come right back to that inflammation of the vagus nerve. It could be higher in the brainstem. Either way, we have to try to attack that. So learning different things like vagal nerve techniques, trying different things like taping. You can activate vagus just by humming and singing. the vibration, right? So there's a number of like very low key things that you can do. There are specific spots you can rub on your face and neck. There are tape spots that you can use. So just diving into the neuro side was different for me, or, taking the cobwebs out. But as a human, you're not just a cardiopulmonary system, right? You're not just a neuro system. Everything works together at all times. And sometimes you have to step back outside of your specialty and look at the whole picture and connect the dots.